Okay, everybody. Let's see. Hold on. It's stuck. It's stuck in going live mode over here.
What's it
See?
say on the right?
Oh, wait a minute. Okay. I don't know where we are. Let's see. VBF. VBF. We're live. Okay. Now we are on. Come on over, Stuart. Well, it only took us 20 minutes. Alright, let me turn the sound down on here. Alright, everybody, much apologies. Maybe it's COVID has infiltrated technology or Facebook, one of the two. If you could post and let us know that you're on. I'm not seeing any messages.
Well, something, these numbers are changing. Does this mean people logged on?
Yes. I just put I'm here because I'm trying to see if I can see my own. Could some of you text us, please, that you see us, or text us hello? I'm only seeing me on here. Oh, here we go. All right. So, Ava Piles. All right, everybody. Okay, now you see us. See, this is why I need it. It's not showing up on here. You see how the questions aren't showing up on here, Stuart? See how nothing's showing up? That's why I have to keep the phone. See, all these people are coming in, and if we don't have the phone and this, we don't see it.
Well, what happens if you click on that? Can you see the people?
I don't know. But no, it's just telling you how many are on. Let's see. Comments. I don't know. We'll just use it here. All right, everybody. Sorry, we've got two things going. Technical difficulty. Oh, what are you doing? Stop. Stuart! Where's our video?
There.
Stop.
There.
Stop.
It's there. I was just wanting to... you can see messages.
I know that, but they're not showing up, which is why I told you I keep this. Sorry, everybody.
Well, I think the messages may be there.
They're not showing, and this is why I have the phone, because they don't always show. We can't see them.
Hit Insights. Now look in the lower right-hand corner.
No, I don't see. Now, where are we? Where are we? How did you get back to the video? How did you get back to us? Sorry, everybody. We are really... There we go. We are really having a hard time.
Okay.
All right. Well, there's 34 people on waiting to talk to you.
Okay.
Here we are, January 2022. Not a good way to start, but it is our first VBF Facebook Live coming from Irvine, California. You do see it? Okay. Live with Dr. Stuart Nelson, director of the Beckman Laser Institute. We will stay on because we did lose 20 minutes trying to get started, so we will stay on. Much apologies. Technology, I know now for next month what we need to do and not need to do. So welcome.
Thank you. Still here.
Yeah, he's still here. So one of the things that we're doing now, because we've launched our More Than a Birthmark campaign for 2 years, and many of you have submitted pictures and told us 3 important things about you not related to your birthmark. That's our More Than a Birthmark, because you are all more than your birthmark. So now we are asking all of our experts, like Dr. Nelson, we're starting off our Facebook Lives by saying, tell us 3 things about you that's more than being a doctor or an expert in birthmarks. So what are 3 things about you?
Lifelong Green Bay Packers football fan.
Great.
Inaugural season ticket holder for the Anaheim Ducks.
Awesome.
Father of 4 wonderful children, all who are sane and have their own jobs and medical insurance.
Oh boy, that's a home run. Did you want to throw in about the beautiful wife?
And my beautiful wife, 36 years.
All right. Okay, everybody. So now that we've got that out of the way, I see Caroline and Deb and Naveline and Claudia, Danielle, Kristen. We are here to talk about all things laser. One thing I want to get out there, because of the tons of messages, and I want to be really clear about this. Those of you who have been receiving treatments with the Prima laser, if you're satisfied with those treatments will likely continue. However, Candela has told me they are working on the next generation laser, which will combine all of the most positive features of every laser that's been ever used, and that will slowly replace the Prima and possibly the gold standard V-beam. But who knows? We're all always in change, right? Everything's a change. So, all right, so I see you all on. Tons of you are on. I can see it on my phone. We are now ready to take your questions. Anything that has to do with laser, vascular birthmarks, treatment, diagnostics. I'm thinking you can all see us. It says you're all watching. I think you can all hear us, correct? I hope you can all hear us. You're saying hi. Hi, Anna Camisa. Maria Bastian Lewis, hello from Fallbrook. I'm believing you can all hear us and see us. So, Toby Perna is on, Madison's on. So, we are ready to take your questions. I want to make sure this is working. I'm having to use my phone because we're not seeing the questions on the screen. This is, oh yeah, all right, so, hi Reagan. Melinda from St. Louis says, my 2-year-old son has a stubborn port wine stain on his cheek. He is a patient of Dr. Nelson. Okay, hold on a minute. This is a long one. We had it imaged via ultrasound by Dr. Coletti at the conference. We were told there looks to be something more going on, but it was hard to get a good image. Potential surgery was mentioned if laser treatment isn't working. Dr. Nelson said to order an MRI, but we're still fighting our insurance to cover it. Unfortunately, there's no record of the prior ultrasound. That's because Coletti has them all on his machine. We are unsure of how to move forward. We've taken a 3-month break. What about them coming back to see you and then you writing something that says they need it? This was one that Giacomo saw some deep activity in.
He felt it was a high flow lesion?
Yeah.
Well, then the concern is, could it be an arteriovenous malformation? And the only way really to make that diagnosis is to do MRI and MRA imaging of the port wine stain. I mean, the birthmark is not bright red. I'm not sure, it's not a high probability that this is going to be an AVM, but if the family is concerned about it, the only way to make that diagnosis is to do imaging. Now, I don't have a license to order a test in Missouri, so it would have to be ordered by their pediatrician, who will just have to contact the insurance company, request a peer-to-peer review, and tell them that the port wine stain has been resistant to pulse dye laser treatment, and that there's concern that maybe there is an underlying arterial venous malformation. That would be my recommendation.
Okay, so Melinda, you can email me at vbfpresident@gmail.com. I mean, what if she came back to you for a laser treatment?
Well, we can order an MRI in California. I'm saying
but if she came
I just can't order one in Missouri because I don't have a license.
But if she came here for laser treatment, could you order it?
Yeah.
Okay,
sure.
Because that's another one.
They'd have to stay another couple of days.
Yeah.
I mean, the child has to be put under anesthesia. I mean, that's why it's not easy, and if you've got to have a very high index of suspicion that this is going to show something, because you're going to put the child to sleep for an hour and a half, 2 hours under general anesthesia.
Yeah. So, I mean, the other thing is I can try and get in a hold of Dr. Coletti and see if he can reread, because he kept them all on his ultrasound.
Yeah, let's try and get in touch with Giacomo. What exactly did he find?
Right. Well, we have to go back because we saw 54 patients. All right. We'll work on that. Anna. Hi, Anna Camisa. Hi there. I have a left thigh pelvic diffuse AVM. I was diagnosed with RASA1 and Parks-Weber. I've been on dual chemotherapy, sirolimus, and trametinib. Is there any other treatments you would suggest? My AVM has maintained stable with the medication, but I'm still worsening in terms of hypertrophy, and right leg is now starting to swell. Just worried and stumped on what to do, as I've been told other than medications, there are no other options.
Well, certainly not from a laser point of view. The laser is not going to be helpful now. There has been some discussion of what intralesional bleomycin, has been talked about. And so I am not an expert in these particular types of medications. They come from the oncology group, but perhaps it might be worthwhile talking about something like that with Robert Rosen, who does this sort of type of thing in New York at the AV Malformation Center in New York. He's somebody who's highly experienced at doing this. I would recommend that this individual contact Dr. Rosen, send her imaging studies to him, ask him to review them, which he will do. I've sent patients from California to Bob, and he's been very gracious and generous with his time. He'll review the he'll review the imaging, and he'll contact the patient and decide what makes sense in terms of how to proceed.
Okay. Also, we have on our website Dr. Rosen's email, and you can go right through our Ask the Expert and email him. Olivia Wilson says her 20-month-old had significant lightening of his capillary malformation with just 3 PDL sessions. What is the general prognosis for whether people need touch-ups throughout life if they had success with the laser as a baby?
Well, you're always concerned that there's a deeper component to the lesion that slowly and insidiously over time, we know that these are progressive lesions. And so there's always the concern that if some blood vessels are left behind because they were too deep in the skin, that slowly and insidiously over time, you'll get reformation of a certain portion of the port Weinstein. But usually when that happens, those patients, if they've responded really, really well before, will again respond very, very well to the laser. And usually within 2 or 3 treatment sessions, you can get them back to where they were. But a maintenance treatment, once or twice a year would probably be very, very helpful.
Okay, Donna Arns says, are you able to work on pink nevi caused by Wyvern-Mason syndrome?
To be honest, I'm a general surgeon and I don't know what Wyvern-Mason syndrome is.
Okay,
You'll have to tell me.
We've seen some Wyvern-Mason syndrome cases. They have multiple comorbidities, but they have these little pink they look like little light capillary malformation stains, so they are vascular.
Well, if they're vascular, they could certainly be treated. The question is, what's the underlying pathology? They're not like AVMs like you see in some
in
of
literature they've called them hemangiomas, but you know that story.
Okay.
They call everything a hemangioma.
Sure, if it's
but
vascular, it certainly could be treated.
You can send a photo to Donna. You can send it to Dr. Nelson through the VBF website and explain a little bit about it. But and then he can let you know. I don't know where you are. You can always get a test patch too, right? You can get a test patch. Anand Atre says, hi, we are currently treating our 4-month-old daughter with a V-beam perfecta for facial V2 port Weinstein. We have another clinic in the city with V-beam Prima. Is there enough reason to switch doctors for the machine? Do both machines have same efficacy as far as treatment goes? So should they stick with the V-beam or switch to the Prima if they're having...
Well, we have both here at Beckman, and for port Weinsteins, I prefer to use the Prima. And the reason for that is that you could deliver the laser light energy over a much larger spot size. And as we've discussed on several of these Facebook Live, the larger the spot size, the higher the energy density underneath the surface of the skin. So you always want to use the largest spot size you can, assuming that you can get the energy density that you need to do the job. So definitely from that, just from a simple optical engineering point of view, you're going to have a higher subsurface energy density if you have a larger spot. And with that, the Prima, there's no doubt you'll get that. And then the other advantages are it does have a higher energy density. If you want to focus down, you can do that. It's also faster, so if this is something that's done under anesthesia or it's an infant where you want to do the procedure very quickly, those are also very good advantages.
Thank you. Paige Young says, our local pediatric dermatologist wants us to treat the scalp, shaving our infant's hair. But I know the 2 VB experts, I mentioned this, Dr. Geronimus and you, don't treat the scalp. Can you elaborate on why?
Well, the reason is that the hair follicles also contain the pigment in your skin which causes you to tan in response to ultraviolet light, namely melanin. The melanin absorption is why we developed the dynamic cooling device. It's to selectively cool the most superficial layer of the skin which contains the melanin so that you don't get scabbing and blistering. But hair follicles are full of melanocytes and melanin. So if you take a pulse dye laser and irradiate the scalp, for example, the hair follicles are going to absorb that laser light. They're going to convert it to heat, and you can destroy hair follicles. and those destruction of the hair follicles can be permanent. And so that's why I'm very reluctant to treat hair-bearing areas on the scalp, because I'm concerned that you can induce permanent alopecia.
Thank you. We have a lot of questions on that, so hopefully everybody will go back and re-listen to this episode of VBF Facebook Live. Alexis Kennedy says, I was wondering if treatments have started using the blood flow stopping device that you mentioned in the last Facebook Live. Have you seen any improved outcome with this device?
That we have not tested. That's only been tested in animals. We have not tested that in humans. So that is probably something that's probably going to be at least a year or so away.
Okay, fair. Kristen Verhaden says, I don't know what to ask. I wish I could just show the picture of Zenny and see if we could get some type of help. We can't show pictures on here. See if it's a hemangioma or a pyogenic granuloma. You'll have to send pictures. We haven't had a second opinion, but the trauma and ER trips we can't keep doing again. It's terrifying.
Well,
so that sounds like a PG if it keeps bleeding.
Well, she didn't say anything about bleeding, but if she's going to the emergency room and not having problems with recurrent bleeding, that's going to be a pyogenic granuloma.
Which means
and a good pediatric dermatologist should be able to do a curettage where they literally cut the stalk off. You have to take a special curette and get rid of the granulation tissue at the base so that it doesn't recur. That's the biggest problem.
Or surgically have it removed, because some of them, the high number recur.
They do, if it's not properly curetaged. So that's why it needs to be done by a pediatric dermatologist who's experienced in doing this, and a single treatment, should take care of it.
Okay, that's good. Laurel Ann says, my daughter's port wine stain is the same, really stubborn. So she was referred to a geneticist, and that's the start. She has CM-AVM syndrome.
Were BRASA studies done? We'd have to assume that.
But still, this is why it's been important to do these ultrasounds too. You keep hammering away at these port wines that don't respond, and now we're finding out a lot of them have underlying AVMs, and you need to address the AVM, and then hopefully this stain will later respond. Thank you, that's what I'm worried about. How did they diagnose it? She's talking to someone else. Okay, so it is a PG. It started growing back within 2 weeks of falling off.
Well, then, unfortunately,
that's a pyogenic granuloma.
It needs to be properly curetaged and cauterized the base. So have a highly experienced pediatric dermatologist do that.
Yep.
Or tell us where you live, and we'll try and give you the name of somebody.
Right. Okay, hello doctors, I'm the mom to Kristen and baby Zenny. I had reached out to you before with pictures of what we were trying to diagnose. Okay, as a PG. Dr. Linda felt almost certain it was a PG. We were on topical timolol. It went away after a short time. It's now back again. Okay, so
there have been people who have reported successful treatment of pyogenic granulomas with topical timolol. But in my experience, they recur. The problem is the recurrent bleeding. The parents are very upset and agitated, and it's just better to remove it, curettage, cauterize the base, and be done with it.
Yeah, Dr. Cohen and Dr. Duarte are reporting that they're using the topical beta blocker with success.
Yeah, people have reported. I have not used it for that.
Yeah, I know it might be the size, it might be how deep it is. Who knows? Who knows, right? Krista Marie says, my daughter is 12. She has a lymphatic malformation on her cheek, neck, mouth, and tongue. She's been treated with sclerotherapy, surgery, and laser when she was young. In the last year, she was confirmed to have a PIK3CA mutation. Her lymphatic malformation has been stable, but now with puberty, she's starting to have growth. What are your options for medication, treatments? These were not options when she was young, 12 years ago.
Well, we have used, for the lymphatic malformations, I've talked about this before, some of the phosphodiesterase inhibitors, which are such as the generic Viagra, sildenafil, and also talodenafil, which is, they're used to treat erectile dysfunction, but they're also used to treat benign prostatic hypertrophy in men. And we did a study that my colleague Kari Nelson published about a year or so ago, which showed that patients did extremely well on the Cialis. And I would encourage her to talk to her internist or whoever's managing her vascular malformation, about that. I mean, we've had patients who've had a lot of weeping from their lymphatic malformations, and just within 2 weeks of starting them on these oral phosphodiesterase inhibitors, it stopped. So I would encourage her to pursue that.
Yep. Hi, Donna Watson. She's just talking about her son who had a complex hemangioma that kept recurring on his chin, and he had multiple surgeries to get it to be normal. Both were removed by Weiner, but his chin has significant scarring from the Z-plasty and bulkiness due to the residuum. What is the best treatment option for him? And I've seen it. It is redundant, and you can see a little bumpiness in his chin.
Well, it's one of the considerations, and we do this a lot. It just treats scars, to all different types of scars, burn scars, hypertrophic scars, acne scars, post-surgical scars, is the fractional skin resurfacing, where you can use different devices. You can place the heat underneath the skin using the non-ablative approach, or if you want, you can, and if it's hypertrophic or thick and you want to tighten it, you can actually make little tiny holes in the skin using ablative fractional skin resurfacing. I find myself actually for most scars using both of them, using one to remodel the collagen underneath the skin, and using the second one to deliver topical steroid into the scar to flatten it, smoothen it out. And the advantage of doing the ablative is that you can turn the coagulation up a little bit, so you'll get shrinking and tightening. I mean, my cosmetic colleagues see a lot of patients who've got facial lines and wrinkles, and that's what they treat them with, is ablative fractional skin resurfacing. It will tighten the skin. It works.
And she can see Roy for that, Dr.
Sure.
Because she's right in the Albany area by me. They can hop on a train and go down.
They can go down with you.
I'll go down with them because he's the best for that.
Yeah, Roy told me when at the conference in New York last fall that he's about a third of his practice is now treating scars.
From these, yeah. So this is great. Ava Piles wants to know, can you explain the difference between the Prima and the V-Beam?
Well, they're manufactured by the same company, Candela, and the Prima is the latest iteration of the pulse dye laser and has a number of technical features which I talked about: larger spot sizes, higher energy densities, faster repetition rate. But in addition to that, there's also a second laser inside the box, so to speak. It's called an ND Yag Laser, and those lasers the light is very deeply penetrating, so it can be very helpful to treat vascular nodules if a patient has those, particularly adult patients. It can be very useful to treat thick, hypertrophic port wine stains, and I actually did that just last week. A patient of mine has a big hypertrophic port wine stain on the neck. They're not worried about the cosmesis. They just don't want it constantly rubbing on their clothes. So it's also useful to treat venous lakes, venous malformations, people who've got reticular veins around the orbit. So there's a number of advantages to using those longer, deeper wavelengths. And those are not available, of course, just with the basic V-Beam Perfecta. So it's two lasers in one individual device box.
But you can still achieve the same endpoint if you use the Yag Laser separate with the V-Beam. Like if you have both.
Yeah. Some people have
two separate ones.
Yeah, I mean, a lot of people have Yag lasers for laser-assisted hair removal.
Right.
And if they're in the millisecond domain, which is where most laser hair removal is done, you could actually use that.
Okay, we have a really interesting post from Torger Stolsmark. He's a doctor from Norway, and he has a 10-month-old son with a port wine stain in the V2 area. The hospital doesn't have the PDL, but he has received 8 IPL treatments with Candela Nordals with so far good clearance. I haven't heard of that. Nordlys.
I just don't know the device. I mean,
I don't know it either.
Candela had some marketing arrangements, I know, with a Danish company who manufactured an intense pulse light device. But I just don't know that specific device.
He's from Norway, so maybe that's it. Now he's saying they've got around 60 to 70% clearance, and I don't know. I'm thinking Torger is male or female, whichever. Please email me at vbfpresident@gmail.com because I'd like to get some more information on this. Now he's saying the settings were mainly 1,8 ms and 7,6 joules, wavelength 530 to 750 and spot size 10 by 50 mm.
Mm-hmm.
What is your take on the IPL?
Well, I'm not an IPL user. I mean, IPLs are like a giant light bulb, like this light we have here. And basically, when he said 530 to 570, what you do is that you actually slide a filter into the handpiece. So you filter out the light below 530 and the light above 570. So that's what you're doing. It's a much cheaper technology, which is why it's much more commonly used in countries that don't have access to laser technology, which is much more expensive. The advantage of the laser is instead of putting those filters in there, you get the yellow light out, which is what you want. I mean, you said the filter was 530 to 570, so that's essentially yellow and some little bit of green light. So those are the wavelengths that you want to treat vascular birthmarks. The 8 milliseconds, I'm going to assume, is the pulse duration of the laser exposure. That might be a little bit long for an infant or a young child. Generally, we tend to use the half 1.5 millisecond pulse durations for infants and young children with the laser technology. And then the last number I'm going to assume is the energy density. But not being familiar with the device, these IPLs are highly manufacturer specific. So unless you're really familiar with those particular types of technology, I can't, in all honesty, comment on the parameters that have been used.
He's saying it was 10 by 50 was the,
that's the spot size.
Yeah,
that's
so that's not as large as the Prima, but it's bigger than the V-beam, right?
Well, a lot of these are actually, it could be, a lot of them have actually handpiece, and you put down this giant rectangular handpiece. So it could be 10 by 50. So it could be.
Okay. All right. Someone who's one of your patients, Mandar Koji, Khoje, said, so thankful for you for treating your son, and they're extremely satisfied with the care they receive here. So
well, that's very kind of you. They come down from the Bay Area and from the East Bay, if I remember correctly.
So Sukata says, how do we know whether the vessels are present deeper or in deep dermis, which are not treated with PDL? Does one need to wait to see if redarkening of the stain occurs? Would a laser with deeper penetration result in better results?
Well, a laser with deeper penetration would get you better results, assuming that the light is absorbed. So, for example, with the pulse dye laser, the light will penetrate 1 to 2 millimeters into the skin. If you take the ND Yag laser, that light will actually penetrate 4 to 6 millimeters into the skin, which is why it's useful to treat nodules, venous malformations, venous lakes, and other things. The problem is that the relative absorption for the pulse dye and the Yag are very, very different. So, for example, when I'm treating an infant or a young child with a pulse dye laser, I'm using an energy density, most of the time 7 to 8 joules per centimeter squared. Because the absorption of the light is so much less with the ND Yag laser, in order to make up for that, you have to use much higher energy densities, typically 110 to 150 joules per centimeter squared. So you're talking about a factor of 10 to 15 higher. So if there's not enough absorption, even though the light is going deeper, you're not going to get the clinical effect. And so that's why what we really are looking for is to try and, one of the projects we have is optical clearing, where we're actually applying something onto the surface of the skin to make it more transparent so that the yellow light will go deeper into the skin. But assuming
do you think that'll be a topical someday?
Yeah, we're working on that.
Okay, that's awesome.
I mean, the problem is that you have to have the light go deep enough, but it has to be absorbed. Whenever I am at your courses, I'm showing an absorption spectrum for hemoglobin, and if you look at that slide, you see it's the highest at the blue portion of the spectrum. So intuitively, you would say, well, why isn't my child being treated with blue light? The problem is blue light is so highly scattered, which is why the sky is blue, that it won't penetrate more than about 1/10 of a millimeter into the skin. So even though it's highly absorbed, you won't get it deep enough to treat the blood vessels that you're trying to target.
So is that why yellow light is the most efficient?
Yellow light is the most highly absorbed by hemoglobin.
Okay.
That's why.
And that's why when people ask me, well, we have a new kind of laser device that's a blue light, and then I say, well, Dr. Nelson says that's not as efficient as the
well,
yellow
it's
light.
for port wine stains, but blue light can be very efficient for things that are on the surface of the skin. Like if you talk to a lot of our dermatology colleagues, they use blue light in combination with a photosensitizer to treat these precancerous skin lesions called actinic keratosis. You know, people in Southern California who've got them all over their face, rather than freezing them or excising them, you put this cream on your face which photosensitizes these AKs, and then you use blue light, and it works very well because it's on the surface of the skin.
But not for a port
But not for a port wine.
Okay. Alexis Kennedy says, do you know of any advancements in topical creams to be used in conjunction with Prima?
Not right now. I mean, we were the first to try the topical rapamycin, but we found it was very irritating to the skin. It's very expensive, and it just, in a large study, didn't prove to be helpful. And so, you know, Roy has replicated that study, so right now we are not advocating the concurrent use of topical angiogenic agents.
Okay, again, it's about the baby with the PG. They're in Clearwater, Florida. You can just email me.
Where is Clearwater, Florida?
Well, it doesn't matter. She can email me, and I can get her over to see Dr. Duarte.
Well, Anna Duarte in
she'll take care of
Miami.
it.
I know somebody in St. Petersburg.
Yeah, we have Dr.
Albert Nemeth in
Yes.
Tampa, St. Pete, highly skilled in laser. So I apologize, I just don't know my Florida geography well enough.
Well, we do have on our website at birthmark.org, Find an Expert. You can see 3, I think there are listed for Florida. Anand Atre said our 4-month-old daughter has a V2 port wine stain. She does not have gingival staining or any staining on her lips. Does she run the risk of that in the future?
Not usually, no. I mean, the port wine stains, they're present at birth. They don't grow into other areas over the surface of the skin, or into the gingiva, or into the gum. So I would not be concerned about the teeth, but it could potentially go into the mouth, and you may later on, if she gets older, particularly once they go through puberty, you may actually be able to see it on the inside of the mouth. But I would not worry about the teeth.
Again, it's the... Oh, yeah, it's the same question from the same doctor. Hello from Australia. I love all you do. At VBF, my son is 2 and has a port wine on his face and leg. He has had 6 laser treatments at a baby with no anesthesia. He's now starting to know he is a little different to his friends. He will point at his port wine and say rash or ouchie. I'd like to revisit laser without anesthesia in the future. At what age and how can I prepare him for treatment?
Well,
He's 2.
if you want to do it, you know, I can't see an image, but I mean, in Australia, I would refer you to Dr. Philip Beckor in Melbourne, who's a highly skilled dermatologist who does a lot of laser treatment of port wine stains. I mean, one of the ways to do it without anesthesia, I'm assuming you mean general anesthesia, is to do it with topical anesthesia, where you can use it with combinations of lidocaine, prilocaine, cream. Now, the issue is how big is the surface area? Because there is an issue with using large areas of applications of these topical anesthetics. You can actually cause this condition called methemoglobinemia, which causes desaturation of the oxygen. So I don't like to use topical anesthetics in infants, certainly less than the age of 2. But if somebody's over the age of 2, it's not too large a surface area, it would be reasonable to consider using a combination of lidocaine, prilocaine, cream. But I would not do that if it was the whole leg was involved, because there you run the risk of developing and inducing methemoglobinemia.
Yeah, and that's a very serious concern.
Yeah, it's an emergency. I mean, it's been well described in patients actually with laser-assisted hair removal. You know, men who are having their whole back done, you know, applying all of this lidocaine, prilocaine cream to the entire back. It's actually been very well described.
And they end up in the ER.
They end up in the ER, that's right.
So you have to remember that while your baby can get the numbing cream, first they shouldn't be under 2. And again, it's because you think they're, 20 pounds, so tiny.
Yeah,
and
I don't like to do it.
This is an anesthesia. It is a drug.
Yeah.
And, you know, it's okay, a small spot, but if you're talking a whole arm, a leg, the torso, the whole face, and the amount of it, I've seen some of them gob it on, and, you know.
Well, in order for it to be effective, it needs to be applied as a thick layer.
Yeah.
I mean, I tell patients, parents, apply it so it looks like frosting on a cake.
Yeah.
But if it's a small, reasonable area, okay. But I mean, somebody needs to do a risk-benefit analysis. And
Right.
so I wouldn't be using, these BLT combinations, which are benzocaine, lidocaine, and tetracaine, where they're 10, 20%. I would not do that. But if it was a small area, you could, in consultation with your physician, consider using some lidocaine and prilocaine combinations.
Several people have asked, and of course they always ask this question, Nick and a couple others, what's coming down the pike? We talked about Candela saying they are working right now on a new device that will combine the best of all of them. That should be out next year, but that's all we know. It's just a teaser. Do you know of any new approaches or treatment devices coming down the pike?
Well, I know one of the other, I just found I was in a meeting yesterday with another laser manufacturer, which I can't mention because of confidentiality issues, but there is another company that's working on the development of a green wavelength, and they've developed a newer device that has, again, much more powerful, higher energy densities on much larger spots. They've expressed an interest in us testing that here at Beckman, so I'm cautiously optimistic that in the next 6 months or so we might have a look at that. Now, green light will not go quite as deep into the skin as yellow light will, so that's one limitation of this. And also, green light is also more absorbed by the normal melanin in the skin. So somebody like Linda, who's got a very light skin type, would be an ideal candidate for that. But somebody who's got a darker skin type, or is Hispanic, or Asian, or Indian, or African American, is not going to be a good candidate for that. So it's just...
Yeah, so I don't, so what you're saying now, it doesn't sound too promising as a generic
Well, it's a
laser.
generic, I mean, they have a contact cooling system. They do not have the dynamic cooling device.
Right.
So, I mean, if the cooling technology will protect the epidermis, then okay.
You guess you'll see when
But
you try
when
it.
I'm talking to the company about it, it's just, those are the concerns that I would have.
Okay, so Josh says, my daughter is 2.5 years old and has had 16 laser treatments, and she's 2.5, and she's already had 16. That's a lot, don't you think?
If you're doing it aggressively every 2, 3, 4 weeks,
I
as
guess
it
it can
were,
happen.
and you can certainly do that.
Yeah, because that's 6 a year. Yeah, so she's doing them every other month. That's not too bad. Her facial port wine was on the lighter side, but her last few treatments, although we increased the settings, she doesn't get the bruising, a little red and swollen, but no bruising. Is that still effective, meaning purpura?
Well, the bruising, I always talk to the parent, the bruising has to do with the pulse duration of the laser exposure, namely how long is the light on. If short pulse durations of the laser are used, you're going to get bruising. If you use longer pulse durations of the laser, you're going to have less chance of bruising. So the question is, what pulse duration is being used by the treating physician to do that? I mean, I tell patients, when I see the family in the recovery room, I say, your child is not going to be as bruised today because I was using 3, 6, 10 longer pulse durations because last time we used the more shorter pulse durations. So the bruising doesn't mean the laser was or was not effective. What it tells you is what pulse durations of the laser exposure were being used. You're always going to have more bruising with shorter pulse durations. So perhaps the physician has changed the pulse duration from 1.5 milliseconds to 3 milliseconds.
So
and that could certainly be a cause.
which would cause the most purpura, the 3?
No, the 1.5.
Oh,
short,
so the shorter will
the shorter
cause
ones.
the most.
Oh, absolutely. And when you go to the half millisecond, you're going to see that
Dense
you're going to
purpura?
purpura immediately in the recovery room.
Do you prefer the shorter?
Well, for infants and young children, I use shorter pulse durations, but there's also times if I see a large vessel that I can actually see in the port wine stain, I will at the same time use longer pulse durations of the laser during the same visit and make multiple passes.
Why?
Because you want to target blood vessels of different sizes.
Okay.
If you took a biopsy of these lesions, and I've showed them at your meetings,
Mm-hmm.
the biopsies where you see each one of these port wine stains is unique. And the geometry of these lesions is enormously complex. You can have very small blood vessels in port wine stains, you can have large blood vessels, and you can have a mixture. So in order to target all the different sizes of blood vessels, to be successful, you've got to use multiple different pulse durations of the laser.
Okay, that's really good explanation. Natasha, I'm going to read this, but I'm going to have her email me. Her daughter has severe KTS. She's being treated in Europe, and she has a huge malformation on her back that's affecting her spine, and the mother's very petrified. And I'm going to have her email me and talk to Dr. Tom Brees in Greece and Dr. Coletti in Italy to get an opinion, because I don't really know what you would say. You'd have to look at pictures.
Well, they need to see the imaging studies of this child. I mean, is there an opportunity to? We work closely. I already mentioned Kari Nelson. I'm not married to Kari Nelson. She's not my sister.
Or child.
Or child. She's just another Dr. Nelson. She's an interventional radiologist that we work with. A lot of patients with KT, if you do the MRI and the MRA and you image the underlying vasculature, there's many times there's an opportunity to, you can actually image these perforators where the blood is going from the deeper system to the more superficial system. And if you can actually have your interventional radiology colleague coagulate by either sclerotherapy or endovenous ablation, you can stop that blood from going from the deeper to the more superficial area, and it actually makes the laser treatment better. And so many times, the first thing I do if I diagnose somebody with Klippel-Trenaunay syndrome is that we have them go see the interventional radiologist first, and then come back and see me after as much has been done has been possible.
Okay. So I can also give her Kari's email to get an opinion.
Yeah, depending on where she is.
Yeah, she's in Europe, but it's okay. We can at least get an opinion and maybe get some further imaging done and some options. Miss Claude Carney says, for the treatment of port wine in infants, what is recommended regarding pulse duration? Is there a science? The short pulse duration of 0.45 better over the 1.5? You just said yes.
Well, I use them both.
If other parameters are kept the same.
Yeah, I use them both. I mean, it's not unusual for the family who I was talking to, the family from the East Bay. I mean, if you were to look at went detailed and looked at the operative report, you'll see that often I will make one or two passes. And so using both of those pulse durations in a single visit. So that is certainly reason. You can use them both. One is not necessarily better than the other.
Okay, it's a good explanation. And by the way, those emailing me, it's vbfpresident@gmail.com, VBF for Vascular Birthmark Foundation President @gmail.com, all one word. Thank you for Corinne for posting that. Okay, so Reagan Bailey Campbell. You know Reagan.
I know Reagan
Hi,
very,
Dr.
very well.
Nelson. I'm curious, for those of us with a flat port wine stain, how do we keep an eye out for nodules?
Well, you can see the nodules, or you can feel them. I mean, that's something that should be very obvious, in a mirror. I mean, unfortunately, as I said earlier, these are progressive lesions. Patients, particularly adults, are going to develop these nodules slowly and insidiously over time. And so it can be very helpful, to come in once, or twice a year, have us evaluated. And if we see that nodules are developing, we can flatten and smoothen them out. I mean, the earlier you do it, the better the result. Because if the nodule is thicker or larger, they can be bleeding, they can be more difficult to treat, just almost like the situation with the pyogenic granuloma. So the earlier you do this, and just even doing a maintenance treatment, that should be enough to prevent somebody from developing vascular nodules.
And we are going to go for another 15 minutes because we were late in coming on. We apologize again with the technical difficulties, but we do have quite a few questions in queue, so I have to get some of the new parents waiting. Our son's port wine goes into the medial part of the eyebrow. Do you recommend treatment of skin under that eyebrow or any precautions?
Well, I would certainly recommend the treatment of the skin underneath the eyebrow. I would not treat the eyebrow because, again, for the reason we talked about with the scalp, but I certainly would treat the upper eyelid if that's what we're talking about underneath the eyebrow.
Or maybe any skin like up here, right below.
I certainly would do that, but I would not do that unless I had a metallic contact lens in your child's orbit before I did that. I mean, we do this routinely. Because we see a wide distribution of patient ages, we have all the different metallic contact lenses in triplicate so that we could do this. For example, in an OR day tomorrow, we're doing 7 cases. We have to have these eye shields. So, as long as an eye shield is in place, it's an easy thing to do. It's just make sure that the appropriate precautions are taken so that you're not going to end up with an eye injury.
Very important.
Very important.
No baby should be treated on the eyelid without an eye shield.
I mean, I will tell people in the 30 some odd years now, the Beckman Laser Institute, we have never had an eye injury in the clinic. We've had 3 eye injuries on the research side of the building where there was carelessness, unfortunately, involved by some graduate students and some postdoctoral fellows. But we always put contact lenses in. If we're anywhere above or below the orbital rim, an eye shield needs to go in. And if it's not being put in, and unfortunately, there have been reports of serious eye injuries
Which can be permanent. Retinal damage.
Retinal damage. The most common one is actually injuries to the iris, because again, the pigment that you see in the iris, that's actually melanin. So somebody who's got dark brown eyes has got a lot of melanin, and you can certainly induce an eye injury, which can result in glaucoma because of iris injuries. So just make sure that an eye shield has been properly placed before doing that treatment.
Thank you. Anand wants to know, what is your recommendation for sunscreens? We read that a strong sunlight should be avoided for a full year. Our 4-month-old daughter is currently getting treatment. Is that true, or can we perform outdoor activity with just sunblock?
Well, the best sun protection is not to. You don't want to keep your child from growing up normally.
Right.
I mean,
Thank you.
get a hat, get a big goofy hat, and kids love big goofy hats. And our parents come in with they're very clever. They have these very large brimmed hats. Do that. I wouldn't say don't let your child go outside. The sunscreen I like the best is something called Elta MD UV Clear. And I like it, number one, because all of my dermatology colleagues use it. And number two, sunscreens are all full of chemicals, and I'm allergic to almost all of them. And so is my wife. And so we have found that the Elta MD UV Clear is actually the one sunscreen that we can both use without having problems with allergic reactions. So when I see families here, that is the sunscreen that I recommend. You can buy it on Amazon, off the internet, very, very easily.
And we at VBF are working on a project right now called the VBF Skin Project, where we will be listing all the skin products to use and those to avoid. Hopefully that'll be out soon. Alexis Kennedy, I mentioned about the new laser Kendall is working on. They're hoping by next year. Any tips for mouth bleeding? I get bleeding on the side of my port wine stain.
Bleeding on the gums and the teeth, or
I don't know. That's all that it says. She can write back. St. Pete's is 30 minutes from us. Thank you so much. I guess that's.
So that's Albert Nemeth. That's the pyogenic granuloma. Okay,
right.
So that is solved. You're in excellent hands. Your child is in excellent hands with Albert Nemeth. And would you be kind enough to please give him my regards?
It is. How do you spell it?
Nemeth. Albert Nemeth.
Okay, so she can look that up. She can Google it. Anne-Marie said my 2-year-old son had a venous malformation on top of his foot that was removed as much as possible. I don't know what the question is.
But we generally don't treat venous malformations by surgery. I mean, most of my colleagues, these are treated by interventional radiologists, by sclerotherapy. If there is a superficial component, we can perhaps treat that with laser. But most venous malformations now are being treated by my interventional radiology colleagues, not surgically excised.
Okay, Diana says, hello, my daughter is almost 5 and has port wine on the right side of her face and chin. It also affects her bottom lip and appears slightly larger. We live in Melbourne, Australia. They seem to be reluctant to treating her. Should we try to push for treatment on her lips now or wait?
Well, the lip enlargement is going to be progressive. So I would probably, now I am not a facial plastic surgeon, I was trained as a general surgeon. So then if somebody who is that young has already manifested and is showing signs of soft tissue hypertrophy of the lip, that is probably going to continue. And most of the times that I'm seeing these children being treated, they're sort of, up in the ages of 8 to 10, they're sort of wait, because it will continue, and I would not recommend that it be done right now, no.
So Laura asked a question, which I have a little bit of info on. What can be done for an AVM that can't be surgically removed? So there's both intracranial and extracranial.
I'm sorry.
Go ahead. She wants to know what can be done for AVMs that cannot be surgically removed.
Well, most of my colleagues are not doing surgery on AVM. Most of them are doing some type of embolization.
Well, this is extracranial, not intracranial, not in the brain, the superficial ones.
Yeah, some of them are doing, candidates for are doing some combination of embolization. And if it's a focal lesion, we had a patient a couple of months ago who came in who had this pulsatile lesion on his forehead, and it's coming right off the artery, and they're going to embolize it and then 24 hours later excise it. I had another child who had an AVM of the flank, sort of in the subcutaneous tissue, again, embolization and surgical excision. I mean, if it's easy to do. A lot of times it's not so easy to do. And if it isn't, that's where people now are looking at the intralesional, bleomycin and other approaches.
Alexis, I'm not quite sure what she's saying, but maybe I can figure this out. So her son is 2. He's had 10 Prima laser treatments on his legs. Now she's saying she's looking to get further lightening, so what should she do? I mean...
Well, when you say on the legs, first, my first question whenever I see a child with a port wine stain on the lower extremity is, you have to think, does this child have underlying Klippel-Trenaunay syndrome? So that's first and foremost. And we don't do imaging on infants and young children, or we try not to until they're at least the age of 2 because of the anesthetic risk. To do an MRA of the lower extremities is an hour and a half to 2 hours of general anesthesia. So the first thing I would think about is ruling out underlying Klippel-Trenaunay syndrome, make sure that's not the issue. And then again, if you want to pursue the laser treatment of the lower extremities, it can certainly be done. You can use higher energies on the lower extremity as long as it's done cautiously. But certainly there's no reason not to go ahead with the laser treatment of the port wine stain. But just make sure that there's no underlying Klippel-Trenaunay syndrome.
Okay, thank you. So Torger, please email Dr. Nelson directly, because this is the MD from Norway. Submit all of your questions to him. I'm sure he will be more than happy to answer you, as he will to anyone. Nick Madona's, how many weeks post-treatment does it take usually to see clearance?
Well, it depends on how aggressively the treatments are going on. I mean, sometimes, you'll see it within just a couple of weeks, but a lot of times, and I tell the parents, when we're doing this really aggressive 2 to 4 weeks, you might not see a lot of clearance for several months. And the reason is because the laser, you're inducing this inflammatory reaction underneath the skin when you injure these blood vessels, and you get almost like an irritant dermatitis. I mean, many families will come through your network, Linda, and they'll say, well, my child had a laser treatment a month ago, and the port wine stain is now worse. Lasers don't make port wine stains redder. What they will do in certain cases is that if you're repeating these treatments and you're aggressive about it, the skin is going to get almost an irritant dermatitis. And that can take several months to actually calm down.
Yeah, that's what I told one mom that had that happen. I said, just wait 3-4 months.
Just wait a couple of months.
Yeah.
It will calm down. Sometimes we'll recommend, a very mild over-the-counter topical steroid, 1% hydrocortisone, that can help calm things down. Mm-hmm. But, you can get an irritant dermatitis just as a result of doing the laser treatment. So it doesn't mean that it's not working. Right. It's just that it's being masked. And a lot of kids also get eczema in association with their port wine stains, which can make it look redder. So what you need to do there is to work with your pediatric dermatology colleagues to get the eczema calmed down. No soaps, cold compresses, things like that, cool baths, so that you can get the eczema under the control. And once you get the eczema under control, you'll see, in fact, that the port wine stain is really a lot lighter in response to the laser treatment, but it was being masked because the eczema was flaring.
Mm-hmm. We only have a couple minutes. Michelle, we can't type while we're viewing and seeing all the messages come through, and we can't view images. Could you please, again, spell the name of the sunscreen that you want? And you'll all have to write this down because I can't
It's
type
very
it.
easy. ELTA, E-L-T-M-D, like medical doctor, UV, ultraviolet, so UV, clear. ELTA, MD, UV, clear.
Okay, thank you very much. Tracy says, I had an MRA. I'm missing the left iliac branch. Is there any help for me?
I had an MRA of a lower left iliac branch. So you had an MRA of your lower extremity. So was this for an AVM? Was this for a
I don't know.
KT?
That's all she said. We only have a minute and a half left. How do you know if there is port wine stains on the lips and gums? Because you see it.
Usually you will see it.
Yeah.
You will see it.
Okay. Again, Torger, send your list of questions to Dr. Nelson. My son will be 3, and he has had a hemangioma behind his right ear. She didn't finish the question, but I suppose if he's 3 and the hemangioma is still behind his right ear, it just says he was. She didn't finish it. He was taking propranolol, but it didn't go away. Can it be lasered? So redundant hemangioma.
Well, it depends on what color it is. I mean, a 3-year-old, it would be very unlikely for a hemangioma to be in the proliferative phase or growing phase. It would also be very unlikely for the skin to be still very, very bright red. I mean, what it can be is that when these hemangiomas involute, you basically get a blob of fibrofatty tissue underneath the skin. So what you may be seeing there is just the result of the involution of the hemangioma. Commonly we'll see these on the foreheads of infants and young children, and they may have a little bump there, and then we get rid of the redness. And I say to the family, just wait. With the tincture of time, as your child's head becomes larger, that sort of little bump there will flatten and smoothen out. I mean, don't rush off to see a plastic surgeon and necessarily have that excised, because most of the time the child will just grow into it.
Okay, the final question. Does EMLA adversely affect lasering? Does it constrict the vessel?
Well, sometimes if you use a very, very thick layer and it's on a long period of time, if you are going to do it with an association, you need to scrub that skin with some alcohol, aggressively before you actually do the laser treatment, because one of the ways that these anesthetics work is that they constrict the blood vessels. So if you constrict the blood vessels, you will end up removing the target chromophore, so your laser treatment isn't going to be as effective. So what we will do is that we'll scrub that off aggressively with the alcohol. We'll wait a little bit. Actually, at times, put like a warm compress on the skin to actually cause those blood vessels to dilate again. So yes, in some cases, it can actually make the laser treatment less efficient because you cause vasoconstriction.
Okay, we really need to lock down, but Chandra wants to know, what is your opinion about taking the PKQRA Pic-Ray drug for KTS while doing laser? She was at our super clinic.
Yeah, I have not prescribed those medications, so I'm going to have. They are again coming out of the oncology, the cancer world. I mean, I am not enough of an expert to comment on those, but I just want to be honest. I am not. But when we have a child like that, I refer them to my hematology oncology colleagues at Children's Hospital of Orange County. I mean, all of these medications have side effects. And
right.
These kids.
She's an adult.
Yeah. For even adult,
yeah.
The point is that they generally need to have their liver function tests monitored, their kidney function tests, blood tests. I mean, these are not benign medications at all. That these patients require very, very close monitoring.
One final question from Lindsay, because it's a really good one. When we get the MRI to rule out for Sturge-Weber for our child that has a V1 port wine, will this also see if there's any AVM?
If they're doing an MRI, MRA, yes, you should be able to tell if there's an underlying arterial venous malformation. The only concern is that sometimes these MRIs can be normal when the child's less than 1 year of age. I mean, Ann Comey has told me multiple times that the most sensitive test in infants is actually serial EEG. So depending on how old your child is, I wouldn't necessarily do that MRI, MRA of the brain to rule out Sturge-Weber unless there had been a seizure or there is some type of objective neurological deficit, which is what's pushing your pediatric neurologist to try and make that diagnosis right now.
Well, we had a rough start, but you did a phenomenal job as usual.
Thank you.
And what's happening on October 7th and 8th this year in Irvine?
Well, God willing,
The VBF Super Clinic.
The VBF Super Clinic will be here in Southern California. Hopefully there will be no more variants, or we will have learned to live with the variant, or the variant will have mutated sufficiently that it's not really a threat to public health. And I'm hoping to interact with as many of you as possible. I mean, I miss this. I miss these clinics. I really miss my colleagues. I miss seeing the patients.
We did have our super clinic in New York in October of last year, and we had over 200 people. This will be a similar, so you will see the registrations go live in February, so please make sure you check birthmark.org and our Facebook page to sign up. We will have laser, ultrasound, dental, orthodontics, psychotherapy. It's going to be great. Free consultation. That's October 7th and 8th, 2022 here in Irvine. Thank you again. Stay safe. Stay well, everybody. Next month we have an expert from Pierre Farb to speak about hemangiol and its effectiveness with treating infantile hemangioma. So thank you all. Goodbye.
Bye-bye.